Howdy everyone, Matt and Mateo here, coming at you with another orthopedic special test, and this one is a twofer deal. It is for the cervical and lumbar spine. It is the Kemp test, or the Quadrant test, or the extension rotation test. I could not find the origin of this test. I could not find the original paper where it was discussed. It's referenced very often in some orthopedic manuals, but looking around, and I can kind of speculate that it possibly came from Col Ludwig Kempe, who was a neurosurgeon back in the 70s, 80s, and 90s, who published a lot of research on the spine. So it talks a lot about radiculopathy and those things. So could have come from him, because again, everything kind of lines up. This test is one to determine if somebody's pain is coming from the facet joints, is it a radiculopathy, is it an osteophyte formation, or is there a stenosis. So this test can look for a lot of different things. To perform this test for the cervical spine, you can have the person seated. Then all you do is you extend the head, you rotate to one side, and then you side bend toward that side. And then you can repeat it to the other side. And a positive for this test is a reproduction of their pain or the radicular symptoms. For the lumbar spine, it's the same thing, but you want to have them standing. Now, I have seen it sitting, that they've had people sitting and they perform this test, but it looks like the lumbar spine is mostly spoken about in standing. So all you do is have the person standing. You have them, you kind of brace their lumbar spine, have them extend, they side bend to one side, rotate there. And again, a positive is a production of their pain or the radiculopathy or whatever that they have going on. So that's the way to perform Kemp's test for the cervical and lumbar spine. And for the research on this test, like I have said too many times, there's not a lot of research on this test. Now, could it be that there are just several names of it, so it's harder to find? That could be. Now, it is referenced very often as an assessment for the lumbar spine. It is referenced more in chiropractic journals and things like that as an assessment method. There are a few articles on it. One I could find on the lumbar spine found that it was actually poor at diagnosing facet joint pain. So that's for the lumbar spine. For the cervical spine, there was actually a couple. There was one, it was a clinical trial to see about how good the inter and intra-rater reliability is in using this test to diagnose, like facet joint pain. And these patients were coming in with neck pain, and then they end up with a facet joint block, and they found it was very good for inter and intra-rater reliability there. They did want to use this test as a way to see if it could be a test to do prior to a cervical manipulation to see does it possibly decrease blood flow? And so we could use this as a screening prior to doing a cervical manipulation. And they found it wasn't a good test to use for that either. So there you go. That is Kemp's test, or the extension rotation test, or the Quadrant test. What do you think about it? Do you use this in your practice? Have you heard about it? You think we need to do some research on it to determine if it's a good test and we should use it or not? What do you think? Let us know down in the comments below. And until next time, take care of yourself. Take care of your patients. We'll see you then.